Um, Greetings to all of you. Um, First of all, I would like to thank this opportunity to come before you and talk to men and women. Yes, we are gathered for the men's health, but I'm glad that we have women amongst us. Greetings to the CEO in his absentia, and greetings to the leadership of the hospital. And in summary, I will just say all protocols observed. So mina Sizeka Mashele, I'm an epidemiologist. Sometimes I call myself cancer epidemiologist, but I trained as a field epidemiologist. So field epidemiologist or epidemiologist, we call ourselves disease detectives. So you will know in the police force that if there's a case, they will say your case is with detective so and so. You know that your case will be investigated from there. So with us, we investigate diseases. We find the source and we eliminate it out of the population so that people can live freely. So we gathered here today and one gave 15 minutes. So I'll try to stick to my 15 minutes. So those who are privileged may have received these copies. Yeah. So I'm just gonna take you through this document here, but I will not be using that. I will just be explaining that. Today, for me, is to talk to you about prostate cancer. What is prostate cancer? What are the causes? What are the symptoms, treatment, preventive and measures that we can take? So let's start by talking about what is cancer in general. So you know, or you may have heard that as human development, all the body parts, they start from cells. You will not see a cell in your naked eye, it's only seen in the laboratory. So those cells, as they grow, normally cells should grow in your body so that you can grow in a way that we can see that this person is growing. It's those cells that grows and make up tissues, then organs and so forth, then we have a complete human being. But now cancer, it's when those cells that grows, that make you grow uncontrollably. So you know everything should grow up to a certain level or a certain rate. But this time, the cells are growing abnormally. So when they grow abnormally, it means they will start causing problems. Because if you're supposed to have a finger, your finger will be longer than other fingers, right? It will not be the same as the normal finger. So let's talk about the prostate. You can see in this pamphlet, for those who are privileged, my apologies, I didn't have enough copies. So you can see this picture here. Where there is prostate cancer, there are two pictures there. They show a normal prostate and a cancerous prostate. So you can see how a cancerous prostate looks like. So now we call it prostate cancer because this cancer, it starts in the prostate. So if it starts on the breast, it will be called breast cancer. If it starts on other body organs, we name that cancer according to that organ. So in this case, it's a prostate cancer. And this is a disease for man or male only. So let me talk about the symptoms, maybe before I get to symptoms, there's something called metastatic cancer. So metastatic cancer, it means that that cancer, those cells that grow abnormally, they now moved. They are no longer in that particular organ, on that prostate. Now it has migrated to other body parts. And so that's where when they do treatment, they will talk about stages, the stage 1 to stage 4 or 5. Stage 1 is when still there, it's still a small cancer, it's controllable. Stage 2, it's still there, but it's growing, and it can grow beyond that particular organ and move to other body tissues. So what are the symptoms? So in the documents, the symptoms I'm talking about, it's where they say causes of, they say signs of prostate cancer. So signs, we will not see the signs, but we say there are signs of prostate cancer because we hear doctors talking about signs. So the signs of cancer will see by a doctor or a physician who's treating you or who's diagnosing you. But we see the symptoms. Symptoms in swikombiso. Leswi ku komba ku lexi loko ni vona ku humela leswi, it means I might be having prostate cancer, or I must start suspecting. So because if you see in that picture, they show that prostate, and in between there's a tube that passes through. So when it grows, it will swell, and that tube that passes through that prostate, it will start to be blocked. And then, so you will start feeling trouble when you are going to pass urine number 1. You may have difficulties. Sometimes you may see blood in urine because you can find that prostate now is bleeding. There are some drops of blood that pass through the urine. Those are some of the symptoms. You may have blood in the semen. What is that? So blood in the semen, and someone will ask, how will I see that? Okay. Yeah, so you may see blood in the semen. So what is usually recommended, as men, as we are living, sometimes when we are with our partners, sometimes it's good that you check your health if you are investigating yourself, right? So you can take that condom and you check, you look at the color of the semen that is in there. That's when you are investigating yourself. And this is men's health. We talk about issues related to men. And to you, women, if your man or your husband is going through his personal introspection, checking the diseases, help them, advise them, yes. Because you see you have difficulty in urinating, can we not now check what's happening in the semen? You will also have bone pain, like marambi yangu yote kubaba, and ameshti bukuwai. Sometimes you will have erectile dysfunction. Erectile dysfunction, it means you will have difficulties if you want to score, and then sometimes they will pass a ball or some get goal.
I make any straight, make any straight.
You make a straight.
Yeah.
Okay. So it means you will have difficulties. Your male or the male part or the penis will have difficulty if you are about to have intercourse. So you may not be able to because of dysfunction, that erectile dysfunction. It means the force that the blood pushes doesn't come in the force that is required for you to maintain that enough erection because of that prostate, because now it's starting to swell. You may have weight loss. Weight loss, sometimes they call it weight loss without trying. It means that you are not working on losing the weight, but you are just losing the weight and you don't know, you cannot explain it. So those are some of the symptoms that you can see. Some of them you will read in that document. It's under science. But like I said, science will be seen by the doctor and you see the symptoms. So what are the causes? What causes prostate cancer? Scientifically, we don't know what causes prostate cancer. So if we say the cause, what is it that caused this thing to happen? So there's no exact. There are speculations and suspicions. We say it's genetic. It's a genetic disease. Genetic, it means that we say maybe some people will say this is in our family, in your blood, so something goes wrong during cell development, because I spoke about the cells, because those cells, as they grow abnormally. So something genetically happens that will lead the cells to grow abnormally. But there are, here they wrote causes of prostate cancer, and they listed a lot of things. That's what I want to talk about now. Those are the things that we call risk factors. Risk factors means it is something that we say, if you have this, your chances of developing prostate cancer are high, or you are at risk. It's not a cause. No? So some of the risks, the first risk, just being a man. Just being a man, you are automatically at risk, because you can develop cervical cancer. Prostate cancer. This is disease for men. So as long as you are a man, it can happen. Another risk is aging. We usually call this disease a disease of adult people. Why do we call it disease of adult people? Because research shows that it is common among adult male from 50 years and above. So aging is a risk factor, meaning when you are growing old, your risk of developing prostate cancer increase as well. All right. The family history. So family history, if you have a relative or you have someone in your family that once had cancer, any type of cancer, it means that we are saying that the gene, a mutant gene, which is the gene or something in the blood that causes the cells to develop uncontrollably, it's in your family. So you may have had that gene. So as I was in family history, is also a risk factor. And also the issue of ethnicity, let me say, race. There are a lot of black people being black men. Most of this disease is most common among black males. So being black, it means you are at higher risk. So this is based on research. They see that, okay, in this year, we have so much number of men who developed as compared to other races. So by being black, it's a risk factor. Get me right. It's not a cause of cancer, but it is a risk factor. Obesity as well. Obesity is also a risk factor. And they also mention being HIV positive. You know that HIV deal with immune system. It destroys the immune system. So once you have a weakened immune system, there are chances that your body will not be able to defend you against various types of diseases. So that's why HIV positive is also indicated as a risk factor. However, we also have protective factors. So protective factors, it means these are the things that you say when you are in this category, or when you have A, B, C, your chances of developing prostate cancer are limited or are low. Healthy diet. So healthy diet, we talk about eating food that contains vegetables and fruits. Fruits and vegetables have got several vitamins that will help your immune system to fight. And then it does not fight the disease, it improves your immune system, your what do you call it, muscle to fight any foreign organisms in your body that may cause diseases. Another protective factor is regular exercise. So when we talk about regular exercise, it doesn't mean that you have to go to the field, sports field, and run, or you go to the gym. But regular exercise meaning that you can even do the house chores, just to do anything in the house, just to walk around. Those are exercise. I know there are people these days, we even buy those clocks that will say, no, today you have walked 1,000 steps, 50 steps. That is very important to walk. It's an exercise. It does a lot of change in the body. So now let's move and let's go and talk about the diagnosis and treatment. So one important thing that we need to know is that prostate cancer, the symptoms that we spoke about, at its early stages, you will not see. They are not visible at its early stages. So which means once you start seeing symptoms, it means that now it's at stage 3 or stage 4, meaning that prostate has now grown just at advanced stage. So that is the danger of prostate cancer. You will not see those symptoms at the beginning or at its early stages. However, it is recommended, when you look at this document, I think they are saying that it is recommended that you start your screening at the age of 45. Because we say this disease starts is most common among 50 and above. But we always say that when you see something in your body, go and see your doctor. So the diagnosis of prostate cancer, usually it's the prostate specific antigen. They look for, they will draw blood, they send it to the laboratory, and then they will measure the level of prostate. But it is recommended that if you had sexual intercourse a night before, don't go for screening in the morning, because your prostate antigen will be high. Alright. You will think you've got high PSA. Your PSA will be out of normal because you had sex a night before you go for screening. So if you know that you are going for screening, just abstain just for that night so that you have the correct results. Because sometimes that's why you see that if it's high, they will send you again for another test. They say it's a confirmatory test because you may have had something before, or it may be something that caused the PSA to increase. And screening, it happens in our primary health clinics. I know most of the time when there are campaigns, a lot of men will get screened. But we advise that you go for screening regularly. So if our wives, our women, girlfriends, they go for their routine clinical visit, we can go with them, we speak to the doctors or the nurses there, we ask for prostate screening. They will screen you. Though, however, some may tell you that no, you are still young, blah, blah, blah. But there's a check that there's a form that they help you to complete. They will ask you questions. Have you ever had, what do you call it? Have you ever experienced this and this and that? Then they will tick. If they say they feel like you are at low risk, they may not screen you, but we recommend that just initiate those talks. The treatment is dependent on you. Like I said, that prostate cancer, most of the time it's seen at advanced stage. It depends on your stage. The doctors may choose to do surgery depending on the type of, depending on the disease that you have. So treatment, it's at the hospital, the referral pathway So from the clinic, where they will do your PSA, they will refer you to the next level of care. So you don't have to worry much to say, okay, where will I go after this? They will refer you. Okay, so let me now talk about, give you some statistics before I close. These are the statistics for 2022. This is a year before last, from the National Cancer Registry. So we had over 10,000 men who were diagnosed with prostate cancer in 2022. I think the right number is about 10.3, somewhere there. So we have over 10,000, and the likelihood ratio of getting prostate cancer among men is 1 in 15. It means that among 15 men, 1 will develop prostate cancer in his lifetime. And most of the cases from that 10,000, just above 6,000 cases were black men. And the age group, because I spoke about age of 50, so I think it's important to highlight this. These days we are starting to see prostate cancer among young people. So from that 10,000, we had about 70 cases. So these 70 cases are between the age 30 and 39 years. 70 cases, so it's a lot of cases, and which is not common. And we had 200 cases from age 40 to 49. So we talk about 270 cases from the 10,000.